I'm nervous in front of the camera.
How are you?
No.
Yeah. You're unfamiliar. Only 200 hours of COVID briefings.
All right. Rolling.
Okay.
3, 2. There he is. Stand up, large stealth. Stand up, large stealth. How are you? All right.
Just over 3 years ago, most Nova Scotians couldn't name our Chief Medical Officer of Health. With over 200 hours of COVID briefings during one of the worst health crises in a century, Dr. Robert Strang became a household name. I sat down with Dr. Strang to reflect on the last 3 years. We started at the beginning, a good place to start.
Yeah, so I certainly first became aware of something unusual, respiratory illness happening in Wuhan, China, it was right after Christmas in 2019. And fairly quickly, when everybody sort of came back to work after the holidays, we started having calls. There was a national group called the Council of Chief Medical Officers of Health, where myself and all my counterparts at the federal level and all the other provinces and territories. So we started discussing this and started to watch it more carefully. Started to bring together people here in the Nova Scotia health system saying we need to kind of pull out our pandemic plan, what we learned from 2009 H1N1, and start to talk about how the different parts of the health system need to get kind of on the alert, if you will. Some of that was our thinking was always based on pandemic preparedness around an influenza-like event, and 2009 it was controlled with mostly a vaccination program and didn't have those big much wider impacts. And also the last major pandemic is over 100 years ago, the great influenza of 1918, 1919. And so we don't have the recent historical experience, but even when we look back, society is so much different today that I don't think any of us really knew until we were starting to get into it about how big this was going to be.
A lot of people remember, they see the lockdowns as, well, not lockdowns, but keeping us apart as a knee-jerk reaction. But a lot of people don't remember that we went from presumptive virus to community spread to somebody dead within 3 weeks.
Yeah.
How did that feel, knowing you had the responsibility to help the public with that?
And then those certainly weren't easy decisions. And again, I have to go back and give credit to the Premier at the time, Premier McNeil, who made my job much easier than perhaps in other parts of the country, because he was very clear that the public health, protecting the health of the public was going to come first. And then he looked at me, figuratively and literally, to say, well, how do we do that? Well, what does that mean for closing down the border? What does that mean for closing schools and businesses? All of which we had to figure out really quickly, but there was no hesitation to do what was necessary. And if we look back from where we are now, that we did a really good job in Atlantic Canada. Our overall level of mortality, even up to, when you take all the way up to 2023, has been substantially lower than the Canadian average and in many other provinces and territories. And I think that is because we actually were able to limit and slow down the spread of the virus until we had high levels of protection from the vaccine.
How many people were actually behind you when those decisions were being made?
So I had a team of about 5 or 6 other people that were kind of my immediate team, leading vaccines, leading the work, the detailed work of the operations of public health, the work around working with other government departments for a more cohesive approach. So we had a small team directly that and then my medical officer of health team. So we would the medical officers of health we would really kick around what's the science, and the regional medical officers would tell me what's happening on the ground in terms of the public health response, what they're seeing. And then we would really say, what do we need to do from a public health science perspective? Then I would go to the other group and say, okay, let's bring in some other elements and other contexts that we needed to look at, and what makes sense and how do we position things? What's the best recommendation to bring forward into the Premier's office? Sometimes we had a few days to do that. Sometimes we did that when there was a sudden shift in a matter of hours. But my focus was always to make sure that we had lots of conversations, first on the science and then kind of the practical implications, logistics and other things, if you will, so that when I was then as the lead taking forward either making a decision or a recommendation in the Premier's office, that I could be confident in that because we'd kicked it around in a lot of ways, and what ifs, what about this, what about that, to come to a decision point or a recommendation that all of us were as solid as we could be, knowing that there was always lots of unknowns and changing. And that's why I always said, we'll make the decision based on the best information we have in front of us, and we may have to change that decision, maybe as early as tomorrow.
Restrictions eventually would lift after a tragic spring and months of uncertainty. Summer 2020 saw close to no cases.
We were very much preparing for likely what's coming in the fall, knowing that if this had a seasonal element, it's, as we get into like flu, late fall or winter, but even knowing that the virus was still very much around us. We were keeping it away with some of the, our border restrictions and things like that, and that we're giving ourselves some breathing room. Which I think was important, gave people a break, could bring back life mostly as normal, but it also had significant economic benefits in terms of letting the hospitality tourism industry do at least some kind of recovery, which didn't happen in other jurisdictions. But no, we weren't thinking, it's all done. We were absolutely working extremely hard to be prepared for what was likely to come, and it did happen. And there was also, we were starting to think about, knowing that vaccines were under development, what we would need to put in place for, to have a robust vaccine program.
Yeah, I remember it was probably around November of 2020, Trudeau saying vaccines are going to be a while, don't think too much about vaccines, protect yourself in every other way. But then all of a sudden, end of November, December, we have vaccines. Did you think it was going to be that fast?
We were, no, we were looking, we were anticipating, and our planning was based around kind of earlier on in 2021, we would start the vaccine program. But then, things happened a little faster than that, and that's fine. But there was limited amounts as well. So, but we adjusted, and some of our planning, we started to plan what our vaccine program would look like, and we had my colleague Tracy Barber, who was appointed as the head of the vaccine program in September, October. So we were as prepared as we could be, and to their credit, that whole vaccine team, I have huge admiration for the work they did, but they were able to rapidly adjust not without a lot of headaches and very, very long days, but adjust to those the earlier timelines. But even though we got some vaccine out before Christmas, in many ways that was symbolic, and I think it was important as a sense of hope, because those numbers were extremely small. Right. It still wasn't until January, February of 2021 when we started to have much larger amounts of vaccine and could start to roll it out in a much more robust way. But I think, we had lots of discussion about, do we wait until we got more supply, or do you just roll it out? And I think it was the right decision to start immunizing who you could at the highest risk for them, but also I think it was for the population that I use that word hope. I think it gave a sense of, this is our way out. There is a way out of this pandemic, which was important to kind of see that light at the end of the tunnel starting to glimmer a little bit.
By December 2021, 82% of Nova Scotians had 2 doses of vaccine. And then there was Omicron.
We knew Omicron was fairly early on, all the indications that were shown to be true was more infectious. Fortunately, likely, at the time, we said it was likely less severe, and that turned out to be true. The other thing that became clear really on that, it was the vaccines, while still protective against severe disease, the vaccines against the Omicron strain weren't that great against preventing spread and transmission. So some of that is we had to change our kind of communication, and I think there's still a lot of confusion. That a lot of people said, "Well, why bother?" I think that's why bother with vaccination if they don't work. It's like, no, we have to understand what actually vaccines are meant to be doing, and they're still, which was against, ultimately the first priority was to prevent against severe disease, and that they still hold true with that. They still have a major role to keeping people out of the hospitals, keeping people alive, but relying then on other methods. And we had to. You've heard many times that vaccines are just one part of the strategy. Why we still need people to mask, to isolate, to be careful with their social activities, all those kind of things. It was that multi-layered approach that Omicron really challenged us. That we had to have all those layers working. And I think at a time when people were getting really tired. And I think some people did with Omicron kind of just give up that we seem to be doing okay. We're at a place and we're just going to let it go, unfortunately.
So with Omicron, that's kind of, since it spread so quickly, people were tired. We had held on for 2 years. This also is around the time that the kind of alternative people, the anti-vaxxers, I feel kind of jumped in on that opportunity of people being tired, and you were kind of a representative of vaccines and masking, and they kind of went after you. So not only were you already backed by this team and had to break really hard news for 2 years to us, what was it like to have somebody personally go after you rather than, the province or your job? Yeah,
I mean, well, a couple of things. I very quickly started to distance myself. I've quit Twitter and did that months ago. That's a space where there's just nothing good going on. And so I think, but in many ways, so you got to distance yourself. But I'm okay with, I got thick skin, and I'm comfortable in what we've done. I'm comfortable in my knowledge, and because I work collaboratively, and so I always I check in with people. Are we on the same page on this? And people that I trust, if we are, then other people can throw stuff, and that doesn't bother me. What bothered me was when people brought it to my home and my family, and that was like, to me, just absolutely crossing a line.
In March 2022, Nova Scotia passed a protest law to protect healthcare workers after a group organized outside of Dr. Strang's home. That's part of being a leader, especially when you're a public-facing leader. That stuff's going to come at you, and you got to be prepared to accept that. But there's certain ways, and that's where I think our society has kind of gone off the rails now with social media and personalizing so many things. That's it's okay to attack somebody in the right way because you disagree with their decisions and things, and because they're in a leadership position. But to then personalize it and then bring it outside of their workspace, that's not okay. But facing that was part of my job, was to take that. If you accept all of the kudos and the good job stuff, well, you got to accept the people who don't agree with you. Fine, we'll agree to disagree, but there's a way to do it appropriately and hopefully politely and respectfully put your point forward, and then I'll have a conversation with you, and we may never come to an agreement, but we need to be able to find ways in our society to, as I said, let people lead, make really tough decisions, and put alternative viewpoints forward in an appropriate way that maybe help change somebody's thinking if that's appropriate. But going after somebody, that personal stuff, as I won't go on, way too much of it in our society nowadays. When it did come to the point on July 4th for you to announce restrictions were gone, there were, other than hospitals and people that make their own decisions, did that make that harder to make because you knew there were people rooting for it that weren't rooting for you?
No, because it was the right thing to do. We're at a time and place where, like, again, the same process, kicked it around in public health and then with others around. We talked about this for weeks and weeks. When do you think we'll be ready? Because we could see it coming. And because we did that it was the right decision at the right time for the right reasons. And so if people are going to take credit for that, what I laugh at really is people who say we pressured you into doing that. It's like your kind of anti stuff had no impact at all on our decision making.
Right. So when that happened, did you feel like the people that were following you for the last 2.5 years, that they felt lost? Like, because then we had this two divide.
Well, we still have a couple of camps. Most people have COVID and have moved on, and some have moved on a bit too much, and we still have COVID around. We still have to treat the virus with some respect, but there are some people there who are still in this paralyzed almost by fear of COVID, and we need to help them move on and adapt to COVID as part of as just another virus now that we have to manage. And then there's the other group that are still fighting the battle about never again anti-vax, never anti-masking, all those kind of things, which are equally outside of the realm of our reality. That those are all tools that we need to keep in our toolbox, whether it's for COVID or something else. That some of those we need to start using, as you've heard me say probably many times, do a better job of using things like masking and stuff during the winter months when we have more respiratory viruses like flu and stuff around. I think Nova Scotians did an amazing job. Especially those first 2 years, which were necessary. Year 1 was the year of the unknown. Year 2 was the year of the vaccine, and year 3 we're still in this year of transition. But those first 2 years where we really had to make some really hard decisions, and ultimately we told people what they needed to do, but it only worked because people chose to do it. Nova Scotians, by and large, did what was necessary to get us through those 2 years to the point where we could actually be much more relaxed and not overwhelm ourselves, because vaccines work. Vaccines are that important wall of protection we built, but we did the really hard work and did it really well for those first 2 years. And it ultimately it's because Nova Scotians stood up and put forward that I'm going to do hard things because it's important for others around me, important for my community. So Nova Scotians should collectively be really proud of how we all work together to get through where we're at now in the tail end of the pandemic.
It's been a long 3 years, but if we have learned one thing, we are stronger as Nova Scotians when we are together. I'm Katy Jean with SaltWire.